Eating mattresses, drinking gasoline, and chewing dirty diapers. This isn't fear factor. This is reality. And today, we are going to react, analyze, and break down all the addictions in the world.
I love air freshener. I love it. Absolutely. What I love about drinking air freshener is the taste. So we just spray it over the ice and then you just eat it from there.
Oh God, please don't do that. It contains all these propellants, solvents, and formaldehyde. So inhaling or ingesting all this can lead to all the respiratory dysfunctions or even all the organs which is there, being it liver, kidneys, it can affect. So more than aromatherapy, it's going more towards toxicology.
My name is Chantal Banks, and I'm crazy obsessed about my rats.
I mean, I love animals too, but this is like rats. It's just welcoming all the risks of infection with bacteria and viruses, being it leptospirosis, hentaviruses, or salmonella. Not to mention, it's just risk for the person. Also, apart from that, it can also have the social withdrawal from other people, having this kind of addiction where you're obsessed and want to always be with rats. So thank God she's just being with rats and not eating them.
My name is Jennifer, and I'm addicted to eating mattresses. I like my mattress plain and straight up. I know mayonnaise, butter, none of that.
Come on, yeah. So mattress is more like this polyurethane foam, lot of adhesives into it. So I don't know. Sounds like dinner? Not to me. But main problem is that in the long term, that can lead to any gastrointestinal obstruction, any gastrointestinal pain, nausea, vomiting associated with it, and also a lot of chemical poisoning that can happen in the long run.
My name is Bria. I'm 19 years old, and I'm addicted to eating sand. I just love the crunch.
If you really love the crunch, you could just go with chocolate with fruit and nut or chocolate, the crispy, the nutty chocolate, right? But please, you could have avoided sand. And again, it is just something that's harboring all the parasites and can long run can cause intestinal obstruction, just gonna be there in your body and causing no benefit. It is just one of the classic forms of pica where you're just ingesting into all these food items which is not providing any nutritional benefit for the body.
My name is Riley. I'm 25 years old. I live outside of Buffalo, New York, and I'm addicted to being an adult baby. I dress as a baby as often as I can.
So well, this looks like more like it's psychologically complex, being it from childhood trauma or could be a dissociative symptom because of some event that has happened in the past. So this is not as harmful as it looks like, but it can have its problems having in this daily functioning of the person. And also it is something that requires a psychiatric intervention, also behavior therapy that can help the person come out from there.
I am addicted to drinking gasoline. I can't go a day without it. Like, I crave it, I need it. I'll wake up, go to the washroom, and drink the gas.
That is absolutely terrifying, yeah. But because it can lead a lot of neurotoxicity to the body and also chemical pneumonia, kidney failure, and even death. It is just a type of poison that this person is having. Definitely a full-blown medical emergency and definitely cannot be considered lightly, and she requires urgent intervention to help her come out from that addiction.
I'm addicted to eating drywall. I am literally eating my house.
Nicole has been addicted to eating drywall for over 7 years.
7 years. Like, she's literally eating her own house, and those things contain like gypsum and paper binding agent, and definitely not helping in any sort of way in the body. Can lead a lot of risk of esophageal tear and intestinal obstruction. And even aspiration pneumonia can be a part of it because it is just eating this content for like 7 years, and in long run can be definitely harmful to the body.
Take my 2 fingers, I dab,
And it looks like this.
Laundry powder.
Tastes like sweet.
Sweet. Because those things contain surfactants or brighteners. It can cause mouth ulcers or pharyngeal ulcers, intestinal or esophageal lesions, can cause burning sensation, nausea, vomiting. One spoonful is just poison that's taken up, and I don't really know how she's surviving eating laundry powder. That is really risky.
And my addiction is eating couch cushions.
So she's gonna keep eating and finishing all the cushions because like same as mattresses, this contains synthetic fibers. It is just long and chronic and large amount and causes a lot of toxicity to the body. It is just a call away from a gastrointestinal surgeon for getting a cure for surgically removing all these products that is eaten by this person. And again, it's just chronic self-harm that is masked by comfort.
My life revolves around eating deodorant. When I wake up in the morning, I want deodorant. After each meals, I want deodorant. When I'm stressed out.
Like, come on, yeah. If you really want freshness, mouth freshness, just go with it. Brushing your teeth with toothpaste or at least chew gum. That can do the job of having a fresh mouth. But having deodorant, it has all the aluminum compounds and also ethanol and these preservatives. So it is something that's toxin to the body, kidneys, livers, can lead to even cancer.
My name is Casey. I'm 26 years old. I'm from Fayetteville, Tennessee. I'm eating my husband. I guess with the transfer of his cremains, some got into the cardboard box as well, and I spilled out on my hands. And I didn't want to wipe them off because that's my husband. I don't want to wipe him away.
So because you don't want to wipe him away and now you're starting to eat him, as if that's not going to wipe him away, that is going somewhere else into your body, and poor thing, she is addicted to that. So I don't know if she's fighting to come out of it, but she's just doing over and over again. And it is something really heartbreaking and deeply psychological, and more or less comes in a grief psychosis and also complicated bereavement. So it needs empathy and cognitive behavior therapy and not judgment. She requires therapy and treatment to come out of it.
So I just lifted off my fingers, and here I am today, almost 2 months later, and I can't stop.
Well, you'll definitely have to stop someday. 2 months of licking the ashes, okay. But doing the same for years together, someday the ashes will get over, right? And then hopefully she should stop. Please don't go hunting for new dead body and new ashes where she can do the same thing. Hope at least that will make her end that addiction. So these addictions seem funny, but they're real. So which one of them surprised you the most? Comment down below and let's talk about science behind all these strange addictions. And hey, if you liked all this weird yet real medical science breakdowns, you know what to do. Hit that like button and do subscribe for more.
My name is Nicole. I'm 31 years old and I'm addicted to pony play.
Okay, quick trot. Good party. Oh, that's it. Yes.
Pony play is a form of costumed role play.
Okay, so that's more like a sexual or an identity-based obsession, and doesn't seem much of a harm to the person and to the person around, but it takes a toll into the person's social lifestyle and well-being, and also with the community. So it again requires behavioral therapy and also cognitive reintervention that's required to help her come out of it.
I'm Charles Palabino. I'm 36 years old. I'm from Beaver Creek, Wisconsin, and my wife, Juniper, and I have been married now for 12 years.
Okay, so that is a delusion, more like psychosis. So these people look functional, but they require psychiatric help and also to reintegrate back to reality. More likely, these are seen in schizophrenics. They must be really careful because you never know what they can do, either self-harm or even harm to others. Go.
My wife, Nikki, is a freaky eater.
34-year-old Nikki loves to eat cornstarch all day long.
Cornstarch is soft, it's very fine. It is so good, I cannot stop eating it.
Again, another form of pica, which is not serving any purpose to the body, but can lead to nutritional deficiencies, constipation, and requires medical help.
34-year-old Kelly eats nothing but cheesy potatoes, morning, noon, and night.
I love cheese and potatoes. It's ooey gooey and just yummy.
He just refuses. Just try a little taste.
Well, this is not bizarre, but it's definitely unhealthy because of chronic usage of this can lead to cholesterol, obesity, cardiac problems, and also, again, comorbidities of hypertension, diabetes. It just tracks away.
Josh refuses to believe that his pizza-based diet is responsible for the mysterious illness that has destroyed his life. Specialists Dr. Mike Dow and JJ Virgin are hoping that some shock therapy will open Josh's eyes to the effect of his disastrous diet.
So Josh, this is how much pizza you eat in a year.
My God, that's like a lot of pizzas. It's an option. Is it impressive or is it concerning? Because having that many pizzas, it's like more than one pizza a day. And it's just a wake-up call for all the heart diseases, fatty liver, clogged arteries, and whatnot. So again, it's really bad for the long run.
And I'm obsessed with eating glass.
This is what guys. No. It's absolutely disgusting.
Stop it.
Okay, hands down, that has got to be the worst one. Most dangerous. Because of this, it can definitely lead to intestinal or any internal bleeding that can be there, or perforated organs. It again calls for all the surgical emergencies that can happen because of eating glass.
I'm Bianca and I'm addicted to eating pottery. I can't live without it. It's something that my body kind of just craves. It's kind of salty and kind of gritty. And I like the way it dissolves on my tongue.
Again, more like a pica, where it is adding to lead toxicity or heavy metal toxicity that is there. So in chronic cases, long years of usage, this is going to be bad.
And I love sniffing and chewing dirty diapers. It has to have pee in it. It has to have pee in it.
Come on, like that is just a risk for all the bacteria, viruses, parasites. So this is like definitely medically alarming and requires psychological help as soon as possible.
And I'm addicted to laxatives.
Again, so this is again common among eating disorders, where because of usage of laxatives, there can be dyselectrolemia, electrolyte imbalance, diseases for the kidney, and also cardiac arrhythmias also can be a part of it because you're literally addicted to laxatives. You're losing body fluid.
I do think sleeping with my blow dryer is harmful. I know that it's dangerous because it can impact not just myself. Hey, if my house caught on fire, catch neighbors' houses on fire. I mean, I absolutely care. It seems kind of contradictory behavior, but the truth is that's addiction.
Yep. Pretty much she's know what she's doing, but if you really wanted to be having a blow dryer next to you, could just use fan, right? But yeah, again, chronic usage of this can lead to dry skin and also a spike in your electricity bill.
And I'm addicted to eating rocks. Or just put the whole piece in my mouth and...
Wait, how is she chewing it? It's a rock. Plus there's like zero digestibility, zero nutrition, it's no help to the body. So it is just waiting for bowel perforation or an obstruction or a casualty visit. So it's not going anywhere having rocks. So what causes these addictions? So there are multiple terms that you can categorize them into. First of them being pica, which is craving for non-food items, which is not giving any nutritional benefit for the body. Next is obsessive compulsive disorder, where their repetitive behaviors drawn by their anxiety. And impulse control disorders, the famous one being trichotillomania, where there's repeatedly pulling of their hair and they're just addicted to doing it. And next is grief-related psychosis, where, as you saw, a person eating the ashes of the husband, and it is just grief related to it. And next is body focused repetitive disorder. So it can be childhood trauma or post-traumatic stress disorder. So what can be done for treatment of this? So first being psychotherapy, it can be cognitive behavior therapy or even trauma-based therapy. So next is medications, being selective serotonin reuptake inhibitors, being it mood stabilizers, antidepressants can be used, and also support groups and rehabilitation centers can help. So out of all these addictions, let me categorize from being the worst, highest risk to the least risk. So I'll give a category of very high risk, medium risk, and low risk. So coming into a very high risk, I will put drinking gasoline, eating glass, eating laxatives, chewing dirty diapers, and eating laundry powder under very high risk. And under high risk, I will put first be eating air freshener, eating deodorant, eating drywall, eating pottery and ashes, eating stone, and eating couch or mattress foam under high risk. Coming into medium risk, I will put eating husband ashes, eating sand, being with rats consistently, and eating cornstarch. Oh wait, even eating cheese and potatoes and even eating pizzas, I'll put under medium risk. And for low risk, I'll put blow dryers one, pony play, imaginary wife, and being an adult baby. So behind every addictions out there, there are real people out there battling real trauma, grief, and unmet emotional needs. So I really feel empathy towards these people, and if you find people out there, do call out them for help, be there for them, and make them feel that this world can be a better place, and probably they just need someone to talk to, or probably a therapy session that can make them feel better and come out of these addictions. Because in medicine, we treat the patient and not the disease. So that's all for today, my friends. I hope you guys liked today's episode of reacting to all the weirdest, shocking cases of addictions out there. And I hope you guys liked it. And you know what to do. If you liked it, leave a like and do comment down what you want me to react to next. And as always, you guys take care, stay safe. This is Dr. Bob signing out.